This next story was recommended to us by Patreon community member Brian Dew, known as BDEcon in the Discord server. So shout out to Brian Dew for bringing this story to our attention. Honestly, I researched the story, and it's literally the only, it's not being mentioned so far. So we're covering here because I think it's something that deserves to be mentioned. I'm not an investigative journalist. I can only base my own news coverage off of the work of actual investigative journalists, actual journalists out there doing that, like on the ground work and stuff. So shout out to all the folks that do that work. But this story it's not getting picked up in the mainstream media in any way. It's only been reported in one outlet that we have here. I wanted to dig deeper to try to confirm more of the details of the story, but I wasn't able to myself. And so this is the one place that this is being reported, and I don't see it being mentioned anywhere else. So, happy to bring some attention to it here on the show. The Citizen's Voice, James Halpin, staff writer there, published this article on September 26th. And this is Janine Manta here. A substitute teacher is facing a felony welfare fraud charge alleging she lied about her income in order to collect medical assistance benefits to which she was not entitled. Janine Manta, 40, of Wyoming, is accused of collecting $5,526 in benefits she was not qualified to receive. According to a complaint filed by the State Office of State Inspector General, Manta, who was married last year and now goes by Janine Soupy, completed a benefits review in August 2018, reporting she lived with her child and was a substitute teacher who hadn't been working as much during the summer. In September 2018, the case record was updated with additional information, including Manta's income verification, the complaint says. Based on the information Manta provided, caseworkers determined she qualified for medical assistance. In May 2019, the Luzerne County Assistance Office got word that Manta started working at Bear Creek Charter School and for the Wilkes-Barre Area School District, according to the complaint. An agent contacted the schools, which provided records showing Bear Creek paid Manta from September 21st, 2018 through December 7th, 2018, and that Wilkes-Barre area began paying her November 27th, 2018. The complaint says Manta's income was in excess of federal poverty income guidelines and that she did not qualify for the $5,526 in medical assistance benefits she received from October 2018 through May 2019. The charge alleges Manta failed to report her income as required. So this whole case is about a teacher, a substitute teacher. She filed for employment benefits based on her existing income. After that, she was a substitute teacher. She then, after that, got hired by, a couple of schools she started working at. She got hired by these two schools, and she began working there in September. So it appears that after she filled out definitely after she filled out the initial benefits review, she then got a job. And her income changed. She didn't, remember to update her income with her new income now, and so they then say that because she didn't, update that, she then received some health care over the course of the next few months. The course of the next 8 months, 4 of those months were pre-pandemic. 4 of those months were sort of post-pandemic after things shut down. And the pandemic was we were alerted to it in February. So half of this time it's in the middle of a pandemic, and you have a substitute teacher getting healthcare in the middle of a pandemic. And somehow she is being charged with a felony for that. And I just find that to be absurd. Like, that's crazy. That's a disgusting system right there. This is what we think is humane. This is a moral system here where we charge a substitute teacher for getting healthcare, and that's somehow criminal. It's criminal to get healthcare for anyone. Like, how could that ever be criminal? Let's just make one obvious statement, which is that under a Medicare for all system or a universal healthcare system, nothing like this could ever happen, right? Nothing like this could ever happen if we had a sane Medicare for all system. But unfortunately, we just don't. We don't in this country. We don't have that. And so we instead, we have a private employer-based healthcare system where it's convoluted and this complex, complicated system that you have to navigate. And because she doesn't navigate that complicated system properly. She's somehow charged with a felony. A felony? Seriously? Like, not these people that cause people to die. These health insurance companies cause people to die by denying them health insurance. They don't get charged with any felony. I mean, they all they did was just cause people to die, but no felony there. This woman, she just gets health care, and she's a substitute teacher. Like, she's not rolling in the dough, people. Like, she's not balling out of control here. She's a substitute teacher. She's broke. I'm just going to go out on a limb and say she's broke. All right. She's broke, and she got healthcare. A broke person got healthcare. And somehow we're out here charging her with welfare fraud, with fraud and a felony at that. And I got to be real. I don't know that this story would have even gotten covered, would have even gotten the tiny little minute bit of attention that it got if it wasn't a white woman that this happened to. Like, I don't know if this story gets covered in the same way. Let me just be real. I appreciate Brian Dew for bringing this to our attention, for bringing the story to our attention, because it's not being covered. But it's a great example of how gross our healthcare system is in this country, right? That we would charge a substitute teacher with a felony for just getting healthcare. This is a story that I did think warranted some attention, just to highlight the grossness of our healthcare system in this country. I think that stories like this deserve more attention, and just because they put a human face behind the cruelty of our healthcare system, and I think that that's worth us all paying attention to. This teacher, she's in Luzerne County, Wyoming. So this is happening in Wyoming, and mind you, in Wyoming State, the penalty for a felony, a felony welfare fraud, if convicted, and it's a felony, it's considered a felony. It's a misdemeanor if it's less than $1,000. It's a felony if it's $1,000 or more. So for $1,000, anything over $1,000 is a felony, criminal. Lock that person up. But so the penalty for this is for the felony welfare fraud in Wyoming, is up to 5 years in prison, and or up to $5,000 fine plus full restitution. So that's a $5,000 fine on top of having to pay back the amount in full. So you can get up to a $5,000 fine. You have to pay full restitution and disqualification from the program. So those are not optional. You get disqualified from the program. You have to pay full restitution. So you have to pay back whatever you're convicted of having taken. And then you also have to, and then you can have up to the 5 years and up to a $5,000 fine. But she gets disqualified from receiving healthcare benefits ever, through that program. And she has to pay back the money in full. So that's just like, it's for healthcare. Like, nobody should have to be paying for their healthcare in that way, period. Under a humane system, we wouldn't have that. But that's what she's facing. That's what she stands to face for the crime of not understanding how the health insurance system works in this twisted system here. So FL says, LOL, it's a felony if it's over $1,000. It's over healthcare costs, which can easily be over $1,000. What the fuck? Shaking my head. Exactly. It's like, it's healthcare. It's like, what you can, 2 doses of insulin are going to cost you over $1,000. 2 doses of insulin. If you're a diabetic, you get 2 doses of insulin. That's over $5,000. Sorry, that's over $1,000. If you get 2 doses, there's like $500 and something per dose of insulin. That's like nothing. You're talking about nothing there. That you're definitely going to clear that bar. It's for medical expenses, which is just, it's so absurd. A person got healthcare. That was the crime that was committed here. A person got healthcare. Does anyone believe that person needs to go to jail? Seriously? You don't think that our laws are overly punitive when for any amount of money, for doing that for any amount of money? You're talking about welfare fraud. These are the poorest people. If you're on welfare, it's like you're already poor. I'm sorry, but no amount. So we just saw Donald Trump cheat his taxes. The president of the United States is a tax cheat. He is defrauding the United States government. He is defrauding them by, literally, like, You know, he paid $750 when he was the year that he became president of the United States. When he in 2017 and 2016, both of those years he paid $750 in taxes. In other years he paid zero. In 11 of the 18 years they reviewed, he paid zero. The guy is a straight up tax cheat. He is defrauding the system. He's using, you know, these. There's a $73 million loss that he claimed that is currently being audited by the IRS. $73 million of defrauding by the president of the United States. Nobody's talking about jail time for Donald Trump for what he did. But for this poor woman, a substitute teacher, working class person, substitute teacher, you know, over $5,000 of getting healthcare for healthcare that she needed. That is enough that you think that that person should even have the threat of jail, should even face the possibility of jail. If you think that, that's a demented system right there. It's cruel. That's cruel. It's welfare fraud. You're talking about people that are going to be on that are going to be the kinds of people that can even, you know, come close to getting welfare. It's usually about, it's like, oh, she was qualifying for it. She qualified for that program initially based on our previous thing. All of a sudden she gets a substitute teaching job. It's a substitute teaching job. It's like one of the most like unstable jobs to exist that we have, right? It's so precarious of a job. And that person is expected to, she gets a job as a substitute teacher. Now she's expected to pay $5,000 out of pocket for her own health care. Are you kidding me? That's absurd. Yeah, this was just totally gross. Sorry about the camera, y'all. My Simba keeps playing with the camera over here. Tammy, do you think you can adjust a little again? He's sorry about that, y'all. Simba's getting curious about the camera. He's a curious doggo. All right, good boy, Simba. Okay. All right. So yeah, that was terrible, and just something that I wanted to make sure that we covered here. So thank you to Brian Dew, Patreon member, for bringing that to our attention. It was an absurd story, blew my mind. I just couldn't believe that. I tried to confirm it with some other other outlets, other news outlets, but unfortunately it's not being covered because it's a small story about us, just a substitute teacher. Who cares about working class people? But understand that this could be you or I. This could be any one of us making a mistake on filing for benefits that should just be universal benefits anyways. Why? Just think, like, in a sane society, this has 0% chance of occurring. You give universal health care, free at the point of service, never comes, like, no Canadian is, tell this to a Canadian, their brain will explode. Like, they can't imagine this because it's just is impossible. It is impossible in a civil society. It's not possible, but that's not what we have here, unfortunately. So here we are, charging substitute teachers with felonies over healthcare. Gross.